Next one is an important asana for diabetes. Diabetes may be controlled by the regular practice of Kapalabhati Pranayam and Mandukasana. In case of severe diabetes, grind 1 piece each of cucumber, bitter gourd, tomato, 7 leaves of neem and 7 flowers of sadabahar. Extract their juice and drink it on an empty stomach in the morning every day. You can have it in the evening as well. Patients of heart problems should practice pranayam every morning. After the practice, drink Lufa juice on an empty stomach mixed with 7 leaves of tulsi, 7 leaves of mentha and 2 or 3 seeds of black pepper. This may help control cholesterol level, body weight and may subside problems of blockage. You may change your daily routine slightly and practice yogasana. It may certainly help subside the chronic ailments you have been suffering from. It may cure your diseases permanently because medicines can bring a control over diseases, but yoga may provide permanent solutions. Now practice Mandukasana while sitting Vajrasana. It may be effective in subsiding diabetes and stomach-related diseases. Close your fist with thumb inside the fingers. Place your fist on either sides of the navel. Now breathe out. Knees should be joined together. Now bend in forward direction. And look in front. Breathe out. If you have pain in lower back, do not bend forward. Remember this. Breathe in and come back to the same posture. In Yoga Abhyas, remember this rule of breathing. Breathe out as you bend forward. Breathe in when bending in right, left, upward or backward directions. While breathing out, once again bend in forward direction. It is an effective exercise for subsiding diabetes, Mandukasana. If you have pain in the lower back, press your stomach in sitting posture. This itself may be effective. Now taking a breath in, come back to the same posture. Now second exercise of Mandukasana. Rest your right palm above the navel and left palm above the right hand. While breathing out, bend forward. Try to touch your chest to your knees. Then while breathing in, come back. While sitting in Vajrasana, with ankles in and toes stretched out, you are practicing different exercises of Mandukasana. Rest both the palms on your knees. Now one more important exercise for diabetes. It is known as Yoga Mudrasana. As for Mandukasana, you have to sit in Vajrasana. Similarly for Yoga Mudrasana, you have to sit in Padmasana. This is how you do Yoga Mudrasana. Sit stretched in front, sit in Dandasana, keep both hands on your sides. Now fold your right leg and rest your foot over the left thigh. Fold left leg and place this foot over the right thigh. Now, you are going to practice an asana beneficial specifically for diabetes, Yoga Mudrasana. Rest your left palm over the navel and place your right palm above that. Right hand resting over the left while breathing out, bend forward. You are practicing Yoga Mudrasana. Chin resting on the floor. While breathing in, come back to the same position. When breathing out, you have to bend forward. This was the first posture of Yoga Mudrasana. For the second posture of Yoga Mudrasana, take both your hands behind. Hold the wrist of the left hand with your right hand. While exhaling, bend in forward direction. Slowly, then come back to the same posture. Try to rest your chin on the ground. If you are unable to do so, try to rest your forehead. Again, while breathing out, bend forward. If you have an oversized stomach, then it would be difficult to rest the chin as well as the forehead. Again, come back slowly. Stretch both the legs in front. Although Ardha Matsyendrasana has also proved beneficial for diabetes, not all people are able to do this, so you may avoid that. In the series of easy yogasanas, we will now practice Vakrasana. It may keep your lower back healthy as well as liver and spleen. It may also help to subside your diabetes. Fold your right leg from the knee. Now, position your left arm in between the chest and thigh and rest your left hand near the right toe. Right hand resting back on the ground. Now turn your neck from the right shoulder and look behind as much as you can. Neck is turned to the maximum. This is Vakrasana. Now come back to the same position. Now repeat the same steps from the other side. Fold your left leg. Position your right arm in between the chest and the thigh and rest your hand near the toe of your left foot with palm facing down. Left hand is resting back. Now turn your neck from the left shoulder and try to look behind. Again come back to the same position. These are some of the important asanas for diabetes. Along with Kapalabhati, you may practice Yoga Mudrasan and Mandukasan, increasing your practice initially from 3 times to 10 to 15 times. If your sugar level is very high, you may practice it more. Now sit in Sukhasan. Pranayam can be practiced in any of these asana, Sukhasan, Padmasan or Siddhasan. So you may practice pranayam in Sukhasan, Siddhasan or Padmasan. If you are unable to sit on the floor, then you may practice it by sitting on the chair. So today you have practiced some easy and effortless yogasana.